Hi YouTube, this is Nata-Sleeve, aka Natalie, and today is my 1 month post-op from a vertical sleeve gastrectomy that I had on July 22nd, 2014. Um, Today is August 17th, 2014, so it's not quite a month, but close to it. Um, just a couple things to talk to you about this week. Some pain that I've been experiencing and my follow-up doctor's appointment, and that should be it. So it should be a short one. My starting weight when I first started this journey was 310 pounds back in February of 2014. And when I went on my pre-op diet, I lost some weight and I was 287 going into surgery. And as of today, I was 266. So since surgery, I've lost 22 pounds in a month, which is pretty cool. I've had a couple days where it's stalled out, especially around the 3 week mark. I think because I started introducing foods, we'll call them, even though they were pureed. Um, and I hadn't incorporated exercise yet. This week is the first week that I've felt okay enough to exercise. I had a appointment with my surgeon for follow-up this past week, and he looked at my incisions to make sure that they were healing well, and they are. They're great. They're closed enough now that I can start putting some Mederma scar cream on them, and I hope that that will help a lot. I've done it a couple times, and they just look really good, so I'm super excited about that. And then he did clear me for exercise, which I'm excited about. So I've just been walking. They really want you to do strength training because that helps your body eat its fat rather than its muscle when you're in this ketosis state where you're eating less than 500 calories a day. Your body needs to basically eat itself in order to live. And it's easier for it to eat muscle than fat. But if you are asking your body to use the muscle, then it has no choice but to eat the fat. So I think doing some strength training will help to increase my fat loss as well. The reason why I haven't really started doing it yet, though, is I experienced some pretty severe pain while on my trip last week. If you watched last week's video, you know that I traveled out of town. It was a short trip, but I think I just kind of overexerted myself. And I started getting this super sharp pain on the left side of my belly near the incision where they took the excess stomach out, and kind of shooting down the left side of my stomach going towards my belly button. And I was really worried that maybe I was having a leak or I popped a staple or something. I was really, really worried about it because it was sharp, stabbing. It would come every time I would sit down, stand up, lay down, roll over in bed, reach for something, try to bend over. I mean, I was really debilitated. I couldn't even get in and out of the car. It was really bad. So I asked the surgeon about it, and his diagnosis is that so they take the stomach out. Through a hole about that big, and then they seal it shut. But they seal it closed. But in doing so, they have to cut through several layers. So they cut through your subcutaneous fat. They cut through your muscle, and then they cut through this what's called a membrane. It actually has a name. I want to say it's like peritonitum or something. But basically, it's a membrane that's full of blood vessels and nerves that kind of holds all of your internal organs, like your stomach and your liver, holds it all in there together. And they had to cut through that in order to get my excess stomach out in the sleeve surgery. And in doing so, they had to put an internal stitch in that very, very sensitive membrane. And probably when I was traveling, even though I was very careful not to lift anything, I probably just bent the wrong way and kind of moved that stitch out of the position that it was in during surgery, and it just kind of twisted just a little bit. And the surgeon said that it's a very, very stiff material that they stitch it closed with, so that the integrity of the stitch stays closed, I guess. And so when it moves out of place, it can poke you in that very sensitive place every time you bend and reach and sit down. And so that's what I was experiencing, and he said that I could continue to experience that for as long as 3 months, which I was kind of like, because I need to live, I need to exercise, and I really was discouraged by that diagnosis. But then he followed that up by saying, after 6 weeks, the material that the stitch is made from should soften a little bit. So I'm kind of hoping that that will start happening soon. I had to go back on my pain meds just so that I could exist and go to work and stuff. But I really don't want to be dependent on those. So I've just been taking them at night to go to sleep, and I'm hoping next week I can go off of them entirely. Strangely enough, the more I move around, the more it actually feels better. I don't know if my muscles in there are loosening or what. So I've been doing some walking yesterday and today. I'm not ready to do strength training yet because I feel like my stomach will just rip open if I lift anything heavier than my little Shih Tzu puppy, who is 8 pounds. So I'm just doing really light, small stuff, and I'm hoping that that'll be enough for now. But other than that, everything's going great. Food is staying down good. I'm still not quite hitting my protein and water goals, but I'm doing better every week. I'm supposed to have 64 ounces of water per day. I'm probably getting around 50 on a good day. Protein, I'm supposed to hit 80. Again, 50 on a good day. I have a protein shake every morning that has 30 grams of protein in it, and then I'm trying to get the rest of it from food. But when you only eat 2 tablespoons per meal, it's really hard to get it in that way. So, but the doctor did tell me I'm not eating frequently enough. I need to eat every 2 to 3 hours, and I've been just trying to do breakfast, lunch, and dinner, and it hasn't been enough. So, I'm gonna start doing that this week too, and hopefully that'll give me more energy, and then I'll be able to work out more. So everything kind of relies on everything else, I guess. So anyway, I hope you guys are all doing good, and I'll see you next week. Bye.